We're here with Dr. Andrea Carey, obstetrician and gynecologist. Dr. Carey, thank you so much for being here with us.
Thank you for having me.
Let's get right into it. Okay. What is infertility?
Well, infertility is a very difficult topic and discussion to have. It's also a difficult situation for a lot of couples. The World Health Organization defines infertility as that 12 or more months of active regular intercourse, and regular is not once a month. Regular is at least 3 times a week, of unprotected, no contraceptive methods, and which no clinical pregnancy occurred. So pretty much after a couple who have been having regular intercourse and they see that they haven't been able to get pregnant within that first year, we say that you should come and see the doctor, right? Because truly, how efficient when the couple is healthy, you have an 85% chance of being pregnant in the first year.
Wow.
Right?
Okay.
And by the second year, it's 95%. So if you haven't gotten pregnant in 2 years, that means something is wrong, right? So the issue that we have is to sensitively discuss that conversation with both couples. And a lot of people, because of our traditions, we're willing to accept a woman is having difficulty. But we have to recognize that this is not specifically a woman's issue.
Right.
This is a couple issue. So 1/3 of the time, it is a woman who is having the issue. 1 in 3 times, it is the man. And 1 in 3 is a couple together. They could have children with other people, but no, they're having difficulty together. Okay? I think because of our cultural and historic, people are more accepting of a woman having problems. But I'm remiss if I didn't mention that quite a lot of times the woman is fine. And I have to sit down with the spouse and explain to him that we have an issue, and it is him. And because it is kind of challenging their identity as a man, lots of men are unwilling to do the testing so we can make the first steps.
Right.
And so that's something that I hope that in the future we can stop. It's not about your manliness, it's that we are trying to overcome a problem and we need to do the testing. With the female, though, there are a lot of issues there, too. As you know, 80% of Jamaican women have fibroids.
Yes.
And for the most part, only about 1 in 4 of those women will have problems. And even a small number of women will have problems related to the fibroids, causing infertility. But they are there. I have quite a few patients that once we took out the fibroids, they were able to get pregnant.
Okay.
But that's a small group.
Yeah.
But the more common things are hormonal problems. People don't seem to remember that we have at least 12 different hormones in our body working at any time. And if one is unbalanced, it will throw off the whole system.
Oh.
So we need to find out which hormone is creating the problem. A common one that I see quite a lot is polycystic ovarian syndrome, which is a genetic abnormality. It's not something that the person did.
Okay.
It's a genetic abnormality that requires management. We can't cure you of it, not yet, until we do gene therapy. But we are able to manage it. And I have lots of ladies with polycystic ovarian syndrome who are mothers now. So it is a situation that can be overcome, right? But it needs to be managed properly. That is one more common hormone abnormalities. One that I even was having a talk with some teenagers recently was about tubal health, because that's the next area. So the ovary is where the egg comes from, but the tube is where the sperm and the egg meet. If there's a problem with the tube, what are the 2 commonest causes for tubal problems is an unrecognized sexually transmitted infection like gonorrhea and chlamydia. And of course, with the tube, endometriosis is the next one. For those who don't know what endometriosis is, it is when the lining of the uterus, the inside lining, which is where we bleed from, is elsewhere in the body. And if it's around the tube, when it is growing and regressing, it causes scarring to the tube. And the tubes, I actually call them the most vulnerable thing in a female's body. Even when we're doing surgery, we don't handle them much. that's why laparoscopic surgery, keyhole surgery has come about, is that we are using instruments to touch the tube because we are being very careful with them. So untreated sexually transmitted infection can damage the tube. Endometriosis could damage the tube. In rare cases, previous surgery where scarring had occurred around the tube could also affect the tube. But the problem is, once the tubes are damaged, even when we try to fix them surgically, there's not a guarantee that they'll work. And often, if you don't protect those tubes, the only option for some couples is in vitro fertilization, which is very expensive. Even although it's more affordable in Jamaica than many other countries in the world, it's still very expensive for the average person. And it still only has a 33% success rate. So you really want to protect those tubes. We mentioned fibroids, which is the uterus, so we moved from the ovary to the tube. But, you know, people who have had miscarriages or terminations and haven't been treated appropriately, they could have residual damage that prevents that a pregnancy could clinically have occurred, but it can't attach to mommy. And if it can't attach to mommy's uterus, then you can't get it's not possible to be pregnant, because that attachment that gives us the hormone that we find in the urine. So we have to, as women, and with our young ladies coming up, do everything to protect them, because there's so many areas where just a wrong choice can result in infertility. In the men, smoking is a common lifestyle factor that can affect the sperm count. I see a lot of men using their laptops in their lap. All that heat, it's damaging to your sperm count. So you're supposed to keep, God put the testicles on the outside for a reason. He wants them to be cool. So if you're like a driver or someone who spends a lot of time in your car, getting the reflective cover that we use for the cars when they're out in the sun, put it across your lap, because it can reduce the sperm count. In Portmore in particular, and Maypen, where I also practice, quite a few men sperm count, and when they make some lifestyle changes, sperm count goes up. But having a low sperm count, below 40 million, you're supposed to have 40 million or up per mil per teaspoon. And you're finding men that have very little or none. There's still options available, but it does mean that you're going to have to spend quite a bit of money to fix that. So if we can, again, same thing, make some better choices. There's some people who are born with deformities that might affect their ability to, like hypospadias, where they may not be able to ejaculate properly. Or if you have erectile dysfunction, this is another group that may have issues trying to become pregnant, but that can all be managed, right? So the thing about it, which is why I'm so thrilled about the 21st century, is that we have options that we didn't have, say, 15, 20 years ago. And it's more affordable than it was 15, 20 years. It was really, the treatments for infertility was a purview of the wealthy. No, it is still expensive, but it still can be. Let's say we find a young lady who she has tubal problems from in her 20s. We can probably start putting the money together to do the IVF if there's an issue. So there's still options, whereas before there were none. Basically, I think it's important that when we're speaking with the couple, that we identify the area. Sometimes it's something simple, because we have a lot of people who one partner lives in one country and one partner lives here. So of course, if they're not having sex very often, the likelihood of having an intercourse regularly and therefore pregnancy is low. So we sometimes have to talk about having a little vacation together during the fertile time. So, but dealing with infertility, we have to be very delicate. We have to be really respectful. It is one of the leading causes for couples to break up. So we have to be very careful, not just the diagnosis of it, but the treatment.
How about signs? What are the main signs of infertility?
Well, the thing about it is more of a silent disease. It's only unless you notice that, boy, we've been having the unprotected sex regularly and nothing is happening. There's often nothing else to clue you in. Unless you may notice, boy, the period is a little irregular. you know, or boy, he said, boy, and I used to smoke hard and maybe there's an issue. Most people won't be aware that there's an issue until the 12 months have passed, or even sometimes when a patient comes in and she says to me, boy, you know, my partner's away, but we've been trying every time he comes home, and although it's infrequent, nothing, you know. And I said, boy, even although it hasn't been the 12 months, let's just take a look. Let's see, because you only have short, spans of time together. So let us find out. Can't hurt.
We go for a short break. When we come back with Dr. Andrea Carey, we speak more about infertility amongst couples. You're watching Blueprint to Your Health.